So thanks, Vani, for the introduction. I'll just dive straight into the topic of today, which is essentially RSV epidemiology in older adults and implication for chronic respiratory diseases. We will focus on the Asia-Pacific region. So these are my disclosures, essentially none of note. And let's begin. So the outline for today's talk, first I'll be talking about the epidemiology and burden of RSV in older adults in the Asia-Pacific and specifically in Southeast Asia. Secondly, what is the cause of hospitalization for RSV? And finally, what is the impact of RSV in patients with chronic lung diseases? So starting off, this is a systemic review of papers published in RSV amongst older adults in Asia. So the countries in black are countries that we have data from. So you can see that RSV is a significant respiratory pathogen. It forms a substantial proportion of diagnosis in patients hospitalized for acute respiratory infection or commonly acquired pneumonia. And this is data based on 28 studies conducted primarily in hospitalized patients. And older adults form the majority of patients hospitalized for RSV across Asia-Pacific countries. And why this is important is because these countries are aging, with the percentage of older population expected to increase in the coming decades. And around 30% of these patients actually have concurrent chronic lung conditions, such as asthma or COPD. However, at the center of the map, you'd see a lacunae, which is essentially Southeast Asia, and that essentially is because we have very little data from Southeast Asia, and I'll go on to that shortly. But first, a look at RSV. So we know that RSV is seasonal. On the left side of the graph, you can see basically data from the US, and what it shows is that there is typically a peak in RSV transmission in the middle of the year, and during COVID, of course, this was slightly disrupted because of all the pandemic interventions, but essentially RSV is seasonal. On the right side, this is data from Japan amongst community-dwelling older adults, and what you see is that essentially there is a peak of RSV also, corresponding to the seasonality of RSV. RSV is basically the line in blue. However, Southeast Asia is predominantly by and large a tropical region, and the etiology and the epidemiology of pneumonia is not well described in tropical equatorial regions. And this is of concern in relation to RSV, given that RSV epidemics are known to occur in conjunction with a humid and rainy season, which for countries located at the equator may result in year-round or long-lasting RSV epidemics. And detailed data on the health and economic burden of RSV disease are also lacking from such tropical settings. So the graph on the bottom of the slide is essentially from Singapore, and this is data from almost 30 years ago in the 1990s. And while there were seasonal variations, you can see basically more than one peak of RSV transmission that occurs throughout the year. And RSV trends were actually associated with higher environmental temperature. So it is a problem in countries that are humid and rainy, like Singapore. So what is the burden of RSV amongst older adults in Southeast Asia? Now, there's a lot of data in pediatric populations, but much less so in the older adult population. So these are studies that I could find in literature from various Southeast Asian countries. And essentially what we show is that there is scattered data across the countries of Southeast Asia, but there are definitely gaps in literature. So for example, in Singapore, amongst children and adults presenting for acute respiratory illness at the outpatient setting, RSV was accounted for about 5% of positive specimens. In Malaysia, in patients hospitalized in East Malaysian hospitals, about 50% actually had evidence of one virus or more, with RSV being the most prevalent virus at 14%. And in some studies from Thailand, in the tertiary hospital from Bangkok, essentially RSV was also identified in a large number of patients, 5 to 20%, and essentially hospital mortality rates for RSV and influenza were deemed to be similar. And in a study from Laos, in outpatients with acute respiratory illness, influenza was the most frequently detected pathogen, but RSV also was commonly detected as well. But there are substantial gaps in the literature. So we do know that RSV, however, likely accounts for a significant burden of disease in older adults. And looking at Singapore, essentially going a bit more in depth into the paper that I described earlier, So there are two peaks in the epidemiology of RSV. So you have one peak in the very young, and again another peak in the very old. And what you have is RSV occurring throughout the year, but again, we don't have information on the burden of hospitalization or mortality and morbidity, although we know that it is a substantial problem. So what is the mortality and morbidity attributed to RSV hospitalizations amongst older adults? So I discussed two studies here, one from Hong Kong, which I think is about 10 years ago, and one from China that is slightly more recent. So in a cohort study of all hospitalized adults in Hong Kong with RSV, supplementary oxygen and ventilatory support were required in 70% and about 10% of them respectively, so fairly high numbers. And all-cause mortality was about 9% within 1 month, and the mean length of stay was 12 days. The rates of use of supplemental oxygen and assisted ventilation tended to be higher amongst RSV patients compared with those hospitalized for influenza, but there was no significant difference in overall outcomes. And in the Chinese study, again, there was no difference in rates of assisted ventilation between patients hospitalized for RSV and influenza. So the burden of mortality and morbidity attributed to RSV hospitalizations is probably at least comparable to influenza. And this fits with what we know from high-income countries. So this is basically a systemic literature review of all the studies on RSV in older adults from high-income countries, so the US, Europe, Japan, South Korea. And what they showed was that the case fatality rate for RSV in hospital was about 7%, which is fairly similar to the previous studies that we talked about earlier. So clearly, it is an issue, and especially amongst older adults. And finally, just to compare RSV, influenza, and COVID. So we don't have many studies on this, of course, both because of the relative newness of COVID as a respiratory pathogen, and secondly, because during the initial part of the pandemic, RSV and other non-COVID respiratory viruses actually dropped, if you remember the previous slide from the US, and many other countries around the world. So only recently, with the resurgence in non-COVID respiratory viral infections, can we do a direct comparison. So basically, this is looking at a study, I think, from Germany. So basically, a total of 1,500 patients hospitalized with respiratory disease and either PCR positive for influenza, RSV, and SARS-CoV-2. So you look at the left-hand graph, basically that is looking at the length of stay. And essentially, patients hospitalized with RSV had a slightly longer length of stay compared to patients who were hospitalized with influenza. On the right side, this is the percentage of cases requiring ICU. And again, the percentage of cases requiring ICU care for RSV was more than 10%, and this was actually comparable to patients who were actually hospitalized for influenza. Yeah. And this is data from the US. So again, a more recent study looking at patients hospitalized with either RSV, COVID, or influenza from a surveillance network of US hospitals. So this is data from early 2022 to about middle of 2023. And what you see is that RSV actually, there's higher odds of utilizing oxygen, higher odds of utilizing non-invasive ventilation, and higher odds of ICU admission when you compare against COVID-19 patients and compare against influenza. So definitely, we would say that the burden of mortality and morbidity attributed to RSV, at least among hospitalized patients, is comparable with influenza and even with COVID, if not more. So it is a significant pathogen. So moving on to the second part of my talk, how much does a RSV hospitalization actually cost? Because this is important to bear in mind when we think about the case for vaccination. So again, we don't have much data from Asia-Pacific countries. I highlight two studies from Korea and China that settle on roughly a median cost of RSV hospitalization at about $3,000 US. In contrast, direct costs attributable to RSV hospitalization in the US is actually much higher, with various studies indicating anywhere from $9,000 to $41,000 per hospitalization. Comparing against influenza, again, it's difficult to have a like-for-like comparison, especially across countries, different cost structures, different healthcare ecosystems. However, looking at healthcare systems in Canada, in Toronto, the median cost of RSV hospitalization was about $13,000 per admission, while the median cost of influenza hospitalization was about $14,000. So again, I would make the case that RSV hospitalization is at least as serious and as costly as influenza, and therefore it is of significance. What is the impact of RSV amongst individuals with chronic respiratory disease? So this is a slide from the systemic review of studies done in Asia Pacific, and the answer is that the data is mixed, but generally probably more impact in patients with chronic respiratory disease. So in a Chinese cohort of about 300 patients, the rate of positive detection via PCR in acute asthma exacerbated patients was about 30%, and this was significantly higher than that of patients with deemed to have stable asthma and normal control group patients. And RSV was detected in about 1/4 of them. However, amongst Korean asthmatics that were positive for respiratory viruses, RSV was found in about 10% of patients with a lower respiratory tract infection, and about 25% of patients who had lower respiratory tract infections but no exacerbation. So there's no significant difference. Looking at US data, essentially for patients hospitalized with RSV infection, the majority had at least one underlying medical condition, with about 1/3 of them actually having COPD. So the burden of RSV hospitalizations in patients with COPD or other chronic lung conditions is actually fairly high. And in patients with more severe outcomes, COPD and other chronic lung diseases were significantly more prevalent. So similarly, from another population-based surveillance study in the US, the incidence rates of RSV infection in patients with COPD were 3 to 13 times the incidence in patients without these conditions. And this is data from the Hong Kong cohort that I talked about earlier. So you can see that essentially there were higher odds of acute respiratory failure in patients who had pre-existing chronic lung diseases. And in terms of causes of death, you can see that COPD and events related to COPD were actually fairly high on the list amongst patients, direct causes of death in patients hospitalized for RSV in Hong Kong. So clearly there is burden of RSV amongst individuals with chronic respiratory disease as well. I think this is from the US. So basically after adjustment for comorbidities, hospitalized patients with COPD and RSV were less likely to die, but equally likely to require ICU admission compared with individuals infected with influenza. So essentially, amongst patients with chronic lung disease, again, RSV is a comparable pathogen in terms of morbidity to at least circulating influenza. So moving on to the conclusions, I like this slide from the systemic review because basically it shows us what is the state of the evidence for RSV in hospitalized older adults in Asia Pacific countries. So red is no data available, yellow is limited data available, and green is actually good data. And what you see is that across a number of Asia Pacific countries, and even in Southeast Asia, there is a substantial and significant evidence gap for RSV in terms of cost data, in terms of epidemiology, in terms of complication, mortality. We really don't have a lot of information. This is my last slide. So to conclude, RSV is a substantial proportion of hospitalizations for acute respiratory illness and community-acquired pneumonia amongst adults in the Asia Pacific and South Asian countries, although there are substantial and significant gaps in what we know about epidemiology and the disease burden. The morbidity and mortality attributed to RSV in hospitalized older adults is at least comparable with influenza and SARS-CoV-2, but we don't have a lot of detail on the health and economic burden of RSV disease in older adults from tropical settings. The direct cause, about 3 $3,000 USD per admission in Asia Pacific countries. And from other countries, we know that the costs of RSV hospitalizations are roughly on par with that attributable to influenza. And finally, RSV can exacerbate chronic pulmonary disease in adults with pre-existing chronic lung conditions, such as asthma and COPD, and outcomes in patients who have these pre-existing conditions and who are also hospitalized for RSV is likely to be poorer. Those are my references, and thank you. I think we'll leave questions to the end. Yeah. Okay, thank you very much.